Hello everyone and welcome to Making It on Mondays. Today we're talking about PCOS. But before we start, I just want to tell you a little bit about Making It on Mondays. Making It on Mondays is brought to you by the Acupuncture Pregnancy Clinic, which is an integrative traditional Chinese medicine clinic and an acupuncture clinic dedicated to reproductive health, to IVF support and to pregnancy care. Now these weekly sessions are designed to help and support those on their fertility journey and are all about empowering women and men who are trying to conceive through providing weekly workshops with relevant and research-based resources. Now, in these weekly sessions, we cover topics such as TCM fertility, nutrition, the latest research, mindset topics, as well as tips from the experts both inside and outside of our clinic. Now, today I'm your host, and for those of you who don't know me, my name is Louise Jeffrey. I'm a traditional Chinese medicine practitioner. I'm an acupuncturist and I'm a coach. And I've been in practice helping couples trying to conceive since 2010. So today we're going to be talking about PCOS, and I'm going to share our top tips for managing this condition. But firstly, let's just take a look at what PCOS is. Now, PCOS is Polycystic Ovarian Syndrome. And what we know is that PCOS is a hormone imbalance in the body that affects up to 1 in 10 Australian women. Now, women with PCOS generally have higher insulin levels, which can lead to a rise in the level of androgens in the body. Now, androgens are just a group of sex hormones that help to kickstart puberty. But when we have an increase in androgens in the body, it can upset the delicate balance of our female reproductive cycle. Now, we don't know what causes PCOS, but PCOS carries with it a number of symptoms, such as the appearance of small cysts on ultrasound, irregular or heavy periods, weight gain, especially around the waist, anovulation, which just means not ovulating, acne, irregular hair growth or hair loss, and in some women, they can experience high cholesterol and high blood pressure alongside PCOS. Now, there's also a correlation between PCOS and diabetes and cardiovascular disease, where women with PCOS have a higher risk of developing these diseases. Now, unfortunately, PCOS can actually be a very tricky condition to work with, especially if you're trying to conceive. But having said that, there are ways to treat and to manage the symptoms of PCOS, and that's what we're going to talk about today. So how can we go about managing PCOS and reducing the impact it has on our fertility? Well, I'm going to share with you our top tips for managing PCOS and helping to reduce the symptoms. So here are our top tips. Number 1 is to find a good PCOS doctor. Now, PCOS symptoms can show up very differently from one woman to the next. That's why it's called a syndrome, because you may have 1 or 2 or all of the symptoms I mentioned earlier, but finding a good doctor who knows about managing PCOS is really, really important. Now, it may be an endocrinologist that you see, it might be an OBGYN, or it might be another primary care doctor. What we're looking for is somebody who has experience in treating this syndrome. And what they'll do is they'll run some bloods and they'll do some scans, and they'll suggest what is the most appropriate treatment plan for you. Now, if you're not ovulating, they may suggest ovulation tracking, or they may even prescribe Clomid or letrozole or even metformin. But if you need a referral for a specialist doctor or for someone who is experienced in managing PCOS, please let us know in the comments box below, and we may be able to help. But we believe that it's really, really important for you to get that first level of support, which is to see a specialist who can really keep an eye on exactly what's happening with your hormones and how your PCOS is going. Number 2 in our top tips for managing PCOS is focus on a low GI and high protein diet. Now, what's really important with PCOS is not only eating clean and healthy, but also focusing on a diet that's really high in healthy protein, such as eggs, fish, and chicken, and that's low in refined carbohydrates such as white bread and sugar. Now, if you're a vegetarian, you're going to need to look at really good sources of protein that come from vegetables and from pulses and legumes, etc. And you're really going to have to make sure that you're getting enough protein in your daily diet. But the most important thing to remember as well is we are just reducing the ratio of refined carbohydrates and increasing the ratio of healthy protein and low GI carbs, which is things like brown rice and brown bread, etc. Now, the reason that we do this, that we focus on higher protein, low carb diet is twofold. Number one, this type of diet will help to stabilize your blood sugar, which is often an issue for women with PCOS. But also, if you need to lose weight, then eating in this way can really help that too. And as your weight stabilizes and as your blood sugar stabilizes too, the symptoms of PCOS should lessen. Now, remember I said women with PCOS often have higher insulin levels, not always, but they sometimes do, or they largely do, which can raise the levels of androgens, which is a group of sex hormones, as I mentioned earlier. So eating more whole grain carbs and lean proteins, such as chicken and fish and lots of vegetables, can lower your insulin levels and help you to lose weight. Now, if you need help finding the right mix of foods for PCOS, then seeing a naturopath or nutritionist would be very, very helpful. If you can find somebody who specializes in PCOS, such as Leah Heschman, or she's in Sydney, or a naturopath and nutritionist who at least focuses on fertility, that would be good, or women's health. All right, number 3 in our top tips for managing PCOS is to exercise at least 3 times per week. Now, like a healthy low GI and high protein diet, exercise also helps to regulate insulin and decrease blood sugar levels. And it also helps to reduce stress, which is known to have a negative impact on our menstrual cycle and on our fertility. We also know that exercise reduces the risk of cardiovascular disease, to which women with PCOS are more predisposed. And in fact, several studies have examined the impact of exercise on women's reproductive function in their menstrual cycles. And results show that regular exercise indeed increases the frequency of ovulation, which is often an issue for women with PCOS. And this seems to be because exercise actually improves insulin sensitivity. And insulin directly affects our reproductive function. So if you're wondering how much exercise is necessary, research shows that a minimum of 150 minutes per week, spread across 3 or more sessions, can be highly beneficial in reducing the symptoms of PCOS. All right, number 4 in our top tips for managing PCOS is utilizing acupuncture and or Chinese herbs. Now, in traditional Chinese medicine, PCOS is seen as a pattern of either stagnation of qi and blood and or the accumulation of damp in the body. Now, acupuncture and Chinese herbs work to move the qi in the blood and to resolve the damp accumulation, thereby promoting ovulation and regulating the hormones. We also know that acupuncture is also helpful in reducing the symptoms of stress, and there are specific herbal formulas that we use to treat PCOS specifically. And there's also a particular points protocol using electroacupuncture that we use to help with PCOS. And if you'd like to know more about this, please just let us know in the comments box below and we can share more of those details with you. And then lastly, number 5 in our top tips to manage PCOS is to remain positive. Now, having PCOS is challenging, yes. It can be tricky, yes. But as mentioned previously, the diet and lifestyle changes that I've just mentioned can make a significant difference in the symptoms of PCOS. Many women with PCOS go on to have more regular cycles and they go on to fall pregnant. It's just really important for you to find the right support, not only in a PCOS specialist, but a naturopath and nutritionist if you need help with diet, and an acupuncturist that specializes in PCOS. So in summary, here they are, our top tips for managing PCOS. Number 1, find a good doctor, one that specializes in managing PCOS. Number 2, eat a low GI, high protein diet. This is going to help to regulate insulin and to stabilize your blood sugar, which in turn helps to regulate your hormones and helps you to lose or maintain weight if that's what you need. Number 3 is to exercise at least 3 times per week for a minimum of 150 minutes per week. Like a healthy low GI, high protein diet, exercise also helps to regulate insulin and to decrease blood sugar levels. And then number 4, look into getting some acupuncture and possibly even Chinese herbs, as they can help to reduce the symptoms of PCOS. And then number 5, stay positive. There are lifestyle and diet changes you can make that can make a significant difference to the symptoms of PCOS. And many women go on to have more regular cycles and fall pregnant. So that's it for now. I hope that this was helpful for you. I hope that you got a lot out of it. And if you would like more detailed and resourceful info, visit our Facebook group or our Instagram, or sign up to our mailing list at acupuncturepregnancy.com.au. I'm signing off now. Have a beautiful rest of your day. Bye for now.